Hello, I'm Larry Siegel, a certified sexuality educator, and today I want to share with you some reactions to some clips of sex education. Alright, so the first video we're going to take a look at, I'm going to react to, is about shockwave treatment for erectile dysfunction. I have a feeling this might be one of those Rejuva-wave or Gains-wave type of things that have started to kind of creep up. So let's see what they're talking about.
Everyone wants spontaneity, sexual enjoyment, a healthy sex life without worry. But sometimes there are problems. Over 50% of mature men suffer from erectile dysfunction, while transient ED can affect men of all ages.
Now, I'm going to start reacting right there. That's one of those classic setups for so many men. Half of men 40 to 70 suffer from ED. Transient ED can affect men of all ages. You know, the reality is, guys, I don't care how old or young you are, your penis is not going to get hard every time you want it. There are going to be times where this transient ED is going to be an issue, and we really shouldn't be calling it a disorder. This is normal functioning. So again, right off the bat, there's they're trying to sell you something because they're pathologizing normal functioning.
The PDE5 inhibitors revolution brought new hope, but those pills only treat symptoms, and the dependence on drugs damages men's self-esteem and eliminates spontaneity.
Okay, now again, if a pill it basically prevents spontaneity, what do you call shocking your dick? Right? That's not happening in real time. You got to go somewhere, and again, you're talking about, for the most part, really a more temporary problem. I'm already getting the impression that they are going to be touting this as a permanent solution to completely reverse erectile dysfunction, and I'll tell you right now, that's not going to happen.
Now there's a new and innovative approach that treats the cause of vasculogenic ED and provides long-lasting results.
Vasculogenic.
Introducing the ED1000, extracorporeal shockwave therapy for treatment of erectile dysfunction.
I love the name, the ED1000.
Compact and mobile, the ED1000 suits any clinical or outpatient facility. The ED1000's advanced interface includes a user-friendly touchscreen, making the setup and treatment procedure easy to learn and perform. It's non-invasive and pain-free, with no sedation or anesthesia required.
So this is definitely a sales pitch to doctors to buy this machine and add it to their practice so they can obviously charge more money.
With proven success in promoting cardiac angiogenesis as well as extracorporeal shockwave therapy for treatments in the field of urology, Metaspec now applies the same expertise to vascular-related erectile dysfunction with the ED1000. Applied to the penile shaft and crura, the ED1000's low-intensity shockwaves result in improved blood flow and accumulation of blood in the penile corpora following sexual arousal. An ED1000 treatment series results in improved erectile function with no reported side effects.
Great graphic.
Unlike the short-acting PDE5 inhibitors generally prescribed, ED1000 brings patients back into the urologist's office with an effective medical treatment. ED1000 treatment was also found to be beneficial for patients who previously did not respond to PDE5 inhibitors.
Yeah, that's true.
ED1000 shockwave therapy provides a true long-term solution for erectile dysfunction for patients that depend on PDE5 inhibitors, as well as those who do not respond to them.
Okay. Now, again, they're also kind of saying, or at least implying here, that for those guys that do not respond to Viagra, Cialis, Levitra, that this is the alternative. And I'm kind of getting the impression that they're basically talking about this as a guarantee. For a lot of guys, this really does not work for them either.
Recent patient surveys show that a year after ED1000 therapy, More than half of those treated require no further use of PDE5 inhibitors to obtain an erection and return to an enjoyable sex life on their own schedule. The solution
On their
for
own
men who
schedule?
want to regain their natural erectile function and natural sexual experience and the intimacy all couples desire. Advanced shockwave therapy for erectile dysfunction with ED1000 from Metaspec.
Yeah, I have a hard time getting past this name. It just sounds like it's some kind of toy. You know, it sounds like some comic book advertisement. The ED1000. Now, again, in all honesty, you know, again, trying to make a big deal out of it. This is a legitimate treatment for a lot of guys, and basically, it's kind of an ultrasound treatment where they're using very low frequency ultrasound, and there really is some evidence where it can help, basically help the development of blood vessels in the penis to increase the likelihood of being able to get an erection. Again, don't need to be taking pills, and I guess that's what they mean by on your own schedule. If you're taking a Cialis or a Viagra, for the most part, you have to take it, wait a certain amount of time, get sexy while you're waiting in that time, and then you'll generally have a couple of hours that it will help you before the medication wears off. But of course, they have Cialis now in low dose that men can take every day, regardless of what kind of sexual schedule they may be on, and it gives them that same sort of spontaneity. Now, they don't really describe the procedure here, but it will take several visits to the urologist in order for this full treatment protocol to be completed. And they also don't tell you, they say they do make the statement that you don't need any anesthesia, you don't need anything, but it's not comfortable. It really isn't. It does feel like somebody is sticking needles into your penis, right? And lasts for a couple of minutes. Right? It does not produce spontaneous erection, so you're not going to have to worry about being in your urologist's office or whoever you're getting this done by, and that you're going to be sitting there in the doctor's office with this raging erection. It doesn't really work that way. And in all probability, you may not feel any difference the first time or two that you use it. Now, again, I'm not familiar with this piece of equipment. I don't know what kind of protocol that they're putting out there. It may take 6 visits to the doctor. It may take 12 visits to the doctor. Right? It really all depends. So, you know, it is one of those things where I can say that at this point in time, if it was this magic bullet that they make it out to be, we'd all already be talking about it a lot more. But there's a reason why we're not. Can it help some men? Absolutely. Is it the answer that all men have been waiting for to correct their erectile dysfunction? Not even close. All right? But it is another option. All right? I do want to say something about their comment about the impact on self-esteem that taking a medication can have on a lot of these men. Well, you can't discount the impact on self-esteem that a guy has to face the fact that he's going to a doctor to get his penis shocked on a regular basis just so that he can get an erection when he wants. That can take a toll as well. All right. So of all the things that are out there, of all the gimmicks, all the gadgets that are out there for men, again, I don't know about the ED1000 in particular, but as an option for a lot of guys, especially if Viagra, Cialis has not worked for you, it's definitely worth a try. But I would say keep your expectations realistic. It's not a magic bullet. Right, this is interesting, right? And again, just so you know, I'm kind of seeing these for the very first time with you. So I'm just sort of looking at some of these titles that were given me here. And this, you know, can't go wrong with this one. 10 weird sex facts that you should know. And once you put weird sex facts in the sentence, you've got my attention. So let's see how weird and let's see how accurate these facts are.
So it'll be about. Today's lesson is going to be about
It's a BuzzFeed joint. So it's going to have some good production value. All right, okay, there's one. Right, they're even citing a study, their first fact here. Right, okay, I can get behind that one. No, there is no relationship between how big a man's foot is and how big his penis is. Right? You know what they say about men with big feet, right? They have big shoes. I like the fact they're talking about stretched penile length. Okay. So here's something that does come up a lot for people. You know, when we talk about how many people, and I like this, they admitted to fantasizing about having sex with somebody other than their partner. You know, very few people fantasize about their partner when they're fantasizing. That's the whole point behind fantasy. It gets you out of your real life. Right? And if you are a partner and you and somebody's, you know, your significant other is not fantasizing about you, please don't take it personally. That is kind of the way it works. All right, you're more likely to orgasm if you're wearing socks. So it's more than just a fashion statement, huh? Well, we know that there's some validity to that. All right? We're talking about citing a 2005 study. All right, 80% of couples who were given socks in their staged environment were able to achieve orgasm, whereas only 50% were able to without socks. Now, the thing that sticks in here for me is the staged environment part. And I wonder how much that really kind of played in. Did the socks make them feel more comfortable? Was it cold in that staged environment? And the socks warmed them up, so it made them feel more comfortable? Right. Oh, and by the way, they also don't say it was more enjoyable. I remember we've done a previous episode of Sex Talk with the Siegel Brothers where we talked about how orgasm is not necessarily enjoyable for a lot of people. So they may have orgasmed more quickly. They may have orgasmed where others can't, but that doesn't mean it was more satisfying. It's possible for couples to get stuck together during sex. I've actually seen that. Some women have the pelvic floor muscles, those vaginal muscles that clamp so tightly shut that the guy cannot get out. Heavier men have been found to experience, I'm going to have to go back to that one a little bit. Oh, I think I screwed that up. Heavier men have been found to experience premature ejaculation less than thin men. Okay. That one I'm going to have to take a little bit of an issue with. All right. Again, they cite a study from 2010. Groups of leaner men were found to have suffered from premature ejaculation more than heavier men. There's other studies that show something different. You know, another thing too, just because somebody can show you a study, that does not make it a fact. All right. In my experience clinically, it's kind of the other way around because heavier men tend to be more self-conscious, and anxiety is really what kind of leads to rapid ejaculation. And that, by the way, is the term that we prefer. We've long since gotten away from that term premature ejaculation because it's got so much judgmental connotation associated with it. All right, but I would like to see the particulars of that study, how they set it up. All right. In rare instances, sex can temporarily give you amnesia. All right, that's actually not anything unusual. Yeah, just like people that do morphine often have memory issues. Right? Gay men have bigger penises than straight men. That one I'm going to call bullshit on. Right? That one, no, sorry. Your penis doesn't really have an orientation. Right? So to say that gay men and heterosexual men have different penis sizes? No, men have different penis sizes. But yeah, I'm going to definitely call bullshit on that one. Right? Okay, I know they cite a study, right? But anybody can cite a study. That means nothing. Right? When we're looking at evaluating research, who's doing that research? How did they do that research? How did they set up their methodology? How did they look at their data? What was their conclusion? I mean, there's so much you have to look at. Just because it's a study really doesn't mean it's any good. All right, so moving on to our next weird fact. On average, 20-somethings in the U.S. have intercourse approximately 80 times annually. All right, so 80 times a year on average. Right? Now, they don't really say anything about that, but allow me to. That is way less than the average person. You know, we are, especially now, living in a time where, as weird as this may sound, here's a weird fact. In general, people over the age of 50 are having more sex than people in their 20s. All right, so when they're making they don't really give a whole lot to that weird sex fact, but 80 times a year is pretty below the average, right, for most adults in this country. An orgasm might be able to relieve congestion in adult men. Possibly, probably more likely women. Right? When you look at what an orgasm is, chemically it's a speedball. All right? So you're getting first an injection of speed, followed by an injection of like an opioid type of drug. Right? Imagine crystal meth and heroin. Right? Now, women are a little bit more sensitive to the effect of the speed part of the orgasm. Right? But we have it too. So speed, it's a decongestant. It shrinks the mucous membranes. So it is very, very possible that you may have started this sexual encounter with a stuffy nose, and after you have your orgasm, you can breathe easier. Okay? But I'm going to say more women than men. Okay? Going from having sex once monthly to weekly is estimated to make you feel as happy as earning an extra $50,000 a year. Okay? So if you were having it once a month, and now you're having it 4 times a month, I want that job. $50,000 a year? I'll take that. But yeah, of course that's going to make you feel better. Right? Money, sex, and happiness. An empirical study puts an estimated dollar amount on the happiness level from sex. That's pretty arbitrary. Right? That's another one of those that I would take with a really big grain of salt, within the confines of their own explanation and their own conceptualization of what they're doing. It may fit. In another context, maybe not. But have as much sex as you can. You will feel better. It won't necessarily translate to money in the bank, right? Unless you're a sex worker, but that's a whole different issue. Right? But in your relationships, sure, it's going to make you feel good. All right, that's not really a weird fact, but all right, I'll take it. I don't think those were terribly weird. But this last one is called 7 Things Every Virgin Needs to Know Before Having Sex. And maybe it's just the still image that I'm looking at, but this looks like an angry girl. Let's see what she has to say.
Oh, that's totally cool. Here's some things you should know, though. 7 things every virgin needs to know before having sex. 1. Plan for a bit of pain. It's not going to...
All right, plan for a bit of pain. All right. Now, that's provided your hymen is already or still intact. Right? A lot of people don't talk about is that girls that are in rough and tumble and just riding bikes and playing and climbing and all this kind of stuff. So many women, by the time they have their first sexual experience, have already broken their hymen. Right? So there may not be the reason a need to expect that pain. But you know, there's another side of that too, and I don't know if she's going to go here or not. I'm going to suspect that she won't. But this is part of that kind of sexual hysteria, right? Oh, your first time is wonderful, it's special, but it's going to hurt, so you may want to get drunk just to get over with. Right? It's a difficult message for a lot of girls to hear. I'm not really a fan of trying to prepare girls and women for their first sexual experience to be painful.
Be as painful as like reverse childbirth or having to listen to talk radio for 10 hours until your ears bleed. But if you're in a world of hurt, remove that.
I guess she qualified that.
Get to the doctor. Something could be up too. You might not bleed. Don't go into this assuming you're going to bleed all over the place just because a penis is inside of you.
Okay.
Some will bleed if their hymen breaks for the first time during sex, but your hymen could already be broken from sports.
See?
injuries,
There you
or
go.
That weird bike accident you had. I broke my hymen on a kitchen cabinet when I was 8 while trying to reach for a box of Pop-Tarts. True story. Don't.
Okay. It's also one of those things you may not know when you broke your hymen. It's not necessarily an event, especially if it's happening before your first intercourse.
Sweat it, dude. Blood or no blood, you just lost your virginity. Hell yeah. 3, it's gonna be awkward. Like, really awkward. From the weird faces you may make to maneuvering your limbs like a monkey doing yoga. And then there's hoping you don't fart, which is a big part of first time sex. Your first time isn't going to be like Jack and Rose doing it on the Titanic, especially if you're not on a ship. 4.
So far, if I were a 14-year-old girl planning on having my first intercourse and I'm listening to some of this stuff, I may have second thoughts. Right? Monkey doing yoga? That's a hell of a comparison.
Don't plan too much. OMG, put away your planner. Your planner is for you, not your vagina. Don't decide to do the nasty on the 3rd Wednesday of April after the full moon at 9:47 p.m.
I disagree with that. Right? And I'll tell you why. Spontaneity is overrated, right? Especially when you're first coming into this, when you're first becoming sexually active. Planning is going to be important. Planning and expectations go together. If you can set it up in a way that you know where you're going to be, you can, again, just plan for it. You know that it's going to happen at a certain time. You can really get yourself ready and you really get yourself prepared. This idea of just waiting for something to happen spontaneously, that's been one of the biggest things that has ruined sex for so many people, because it's usually an unrealistic expectation. So I'm really all about planning, especially that first time. It makes it intentional, makes it more deliberate, and that usually makes it better.
It's just going to increase your anxiety about the moment. Just chill. Let it happen naturally. When you two are ready, you'll know it. Turn off their...
This idea of letting it happen, there's a phrase people used to use, say, we just got swept away. And I often use the analogy as a sex educator. In sex, you just get, first of all, if you go river rafting and you just get swept away, you end up as a spot on a rock, right? And if you're not conscious, meaning deliberate, intentional in your sexual activity, that's when people are open to getting sexually transmitted infections. That's when they're open to unintended pregnancies. That's when they're open to emotional stuff. This is where we get most of the negative consequences. I get what she's trying to say, and I appreciate the way she's, sort of delivering this message and who she's talking to, but I don't know that I would really sort of try to bring them in that same way. We want to think about what we're doing. Like I said, especially a first sexual experience, really should be deliberate and intentional.
Reminder on your phone. Yeah, turn it off. 5, protect yourself. If you don't have any birth control, pills, condoms, IUD, what the heck are you two doing getting down and dirty? Make sure you have all that unlocked before getting physical. Imagine getting pregnant or an STD because forgetful Franny forgot her birth control. Pills and IUDs do not protect against STDs. So condoms, and more condoms. Okay?
But also learn how to use them. Right? That's an often neglected part of this. Right? And I've criticized my peers and my colleagues in the field of sexuality education for many years for this idea of just throwing condoms out at it and think that that's doing it. People have to learn how to use it. And believe it or not, a lot of people really do not know how to use condoms. You know, one of the things that I like about a lot of things that I've done over the years is how many young men have come up to me after a class or a particular session and thanked me for showing them and demonstrating how to use a condom because they didn't know how, and most guys are really embarrassed to admit that they don't know how to use a condom. And if we're talking about a first-time experience, there's this unspoken expectation that guys are supposed to know. So again, I agree with that message. We want to plan. You want to know your body. You want to understand sex before you start engaging in it. But learn how to put on a condom. Practice. Right? And for the partner of the male wearing the condom, whether you're male or female or whatever identity might be present, it's a great thing for you to learn how to put a condom on a guy, because now you're not talking about safer sex. You're not talking about protection. You're talking about pleasure and shared activity.
Okay? 6. Speak up. Even if you don't really know what you're doing, you'll know what's comfortable and what isn't. Did they just do a move that made you and your vagina itself cry tears of deep, deep sorrow? Yeah, let them know that you're not digging it. Don't be afraid to tell your partner to slow their roll or to stop altogether if you're not feeling it. Don't clam up. It's your body. It's your rules. 7.
I love that message. Right? I truly love that message, but I think it needs to be delivered better, because the reality is that so many adolescent girls in particular, they just shut down. Right? And this is why I was emphasizing the planning and the intentional part of it. I deal with this a lot and have been over the years in terms of girls who experience date rape. You know, oftentimes in their boyfriend's house with their parents in another room. Right? And the problem is, if you're trying to make this all spontaneous, is that in a heat of a moment, when things are emotional and you're experiencing all these sexual feelings, and there's a whole bunch of stuff that's running through your head and your body at the same time, if that's the moment, you have to try to figure out, what do I like? What do I don't like? Am I okay with this? If I'm not okay with this, how do I tell them? What do I say? And what happens is it short circuits and you're just going to shut down more likely. So planning, thinking about this, having these conversations with your partner before it happens, that's why this stuff is really important.
Only when you're ready. You've probably heard this so many times now that it's going to be someone's cliche yearbook quote. But seriously, don't have sex if you don't think you're ready. As long as your partner isn't a jerk, they'll understand. And if they're a big baby about it, dump them. Congrats. You just dodged a bullet and an unnecessary penis. Virgins, you're ready for sex.
Right.
And I mean...
And again, a good message there, right? And this is where girls have to be a little bit more assertive. Even if the guy is being an asshole about it, right? Then you need to learn how to say, don't let the door hit you on the ass. Out. You're worth it. It's not about him, and it's not about his pleasure. It's about you right now. It's about you in this moment. Right? So you really have to be true to yourself. That's the thing that does so many girls in, that they just sort of disconnect, dissociate, go somewhere else. And not for nothing, but this is where a lot of rethinking what happens then gets redefined into sexual assault. Right? Wasn't really into it. I didn't really want to do it. I must have been coerced. Right? So a lot of what really has been coming out as assault or non-consensual sex is really regret. And more often than not, the regret is coming from not speaking up when it was happening. So again, being true to yourself, having a voice, using your voice. Right? And sex is one place where you really need to be selfish. Right? You really need to be making sure that your pleasure is happening on your terms. You know, what we share with our partner is our own pleasure, our own comfort, our own enjoyment. So if that's not there for you, Don't let it continue.
You're ready for sex?
So I appreciate her attitude. I appreciate her enthusiasm. I appreciate that she's talking to her peers. But there, I think, is a little bit more guidance that should be there. So I'm glad she's out there doing it, but I also don't think that, congratulations and making a big deal is all that appropriate either. Right? It's not that big of a deal. It's a part of life. It is a step that people are taking in their life, but I don't think that there's really any attitude of being a virgin or of not being a virgin that's terribly appropriate. You do you. Whatever that means, however you do that, but you do it comfortably, you do it on your own terms, and you do it with knowledge. All right, so I kind of like that. Even though there were a couple of things that sort of irked me about it. It's one of those where, whatever the failings or whatever the things that I would like to see done differently, I'm glad to see it out there. Well, thank you for watching, and for more, you can tune in on this YouTube channel, premiering every Friday night, Sex Talk with the Siegel Brothers. Please, if you want to see more, like, subscribe, and comment. I'd love to hear your reaction to these reactions, and if you have anything that you think would be interesting for me to watch, please send that as well.